Greetings humanoids, I am the Bog Witch Myst Matty, and welcome to the Lucard Arch YouTube channel. Before we begin, just some terms and conditions. 1, I am not a medical practitioner. 2, the content of this video is not to be taken as medical advice, nor is it to be used in any form of training. 3, always consult a medical practitioner before having a piercing or modification procedure done. Right, so with the technicalities out of the way, this video is going to be about looking after piercings. And the reason for this is because the most common question I get asked is, Maddie, how do I look after my piercings? So that's what this first video is going to be about. So before we get started with how to best look after a piercing, we first kind of need to understand what a piercing is, right? And piercing is a puncture wound in the skin into which a piece of jewelry is placed for the purpose of beautifying the body, to make you look pretty, right? Now, this puncture wound should ideally be made with a needle, as it minimizes secondary trauma to the area. And there are 2 ways that these wounds are placed. Either where the entry wound and the exit wound are perpendicular to each other, so that there's the shortest possible wound and tunnel. This is done in piercings like your lobe piercings, cartilage piercings in your ears, your nostril piercings, your lip piercings, your tongue piercings, just like most of your general piercings is this first type of piercing. The second type of piercing is where the entry wound and exit wound are parallel to each other, with the bulk of the wound being underneath the skin. So the way this works is there's an entry wound, the needle then travels along the skin layers, and then there's an exit wound into which the piece of jewelry is placed. So this type of piercing is things like your navel piercings, your eyebrow piercings, your nipple piercings, just surface piercings in general. Okay, so that's what a piercing is. Now, the best way to heal a puncture wound is to wash the wound with an antibacterial soap so that any dirt or debris that is trapped within the wound can be brought to the surface. You'll then rinse the soap away, dry the area, and then you'll normally protect the site. And then generally you can take something to help with the discomfort if you want. I'm not a medical professional, I'm not giving you medical advice, so if you want to know more about that, speak to a doctor. And then the last thing is to wait for the puncture wound to heal. Now, puncture wounds themselves heal very, very quickly, right? It heals really quickly and generally without any complications as long as you keep the wound clean. Now, because a piercing is a puncture wound, these are the exact steps you want to follow. You want to wash the piercing with a mild antibacterial soap to make sure that any debris that could be caught in the piercing channel is brought out. You then want to rinse it away, rinse the soap away, dry it really, really nicely, and then keep the piercing safe so that you're not bumping it or hooking the piece of jewelry on anything, and then generally it heals up a lot faster. Now, healing time for a piercing depends on the placement, and I will deal with that in future videos where I will be going into each individual placement. But what complicates the healing process in a piercing is the piece of jewelry we put in there, right? And the reason for this is because that piece of jewelry is a foreign object. Now, your body does not like having foreign objects in the skin, and its first natural reaction is to push it out. right? And this is what results in piercings migrating. This is what results in piercings rejecting, is your body's not happy, so it tries to push the piece of jewelry out. Okay, so how do we deal with this? So the way your body pushes pieces of jewelry out and rejects things is through the natural process of inflammation. So it swells up, and that swelling creates the pressure which pushes the object out of the wound. So what we want to try and do is limit this, right? Get the inflammation under control, and then you decrease the chances of the piercing migrating or the piercing rejecting because your body just heals up around it. Now, I'm not a medical professional, and I know I keep saying this a lot, but I need this to be absolutely clear. So I'm not in any way, shape, or form telling you to take an oral anti-inflammatory, and the reason why I'm not doing this is because these things have side effects, and that you need to discuss with your medical practitioner. However, from anecdotal experience, what I've discovered works the best is generally applying ice to the area, because this helps to bring the swelling down, or if it is safe to do so, you can apply a topical anti-inflammatory ointment to the area, right? This will keep the localized swelling down, which will help you aid faster. So that's how you look after a piercing. You keep it nice and clean, and you keep the swelling under control. And I can already hear the mobs gathering and chanting, "But saline solution, Maddie! Wash your piercings with salt water!" I'm going to strongly disagree. Alright, so while saline is an awesome sterile way to keep a laceration clean, because of the way you use salt water to clean wounds, it's not effective in a piercing. Alright, because saline is what's known as an irrigative cleaning method. What is that, you ask? Well, that means that the salt water needs to run over the wound for a period of time so that any dirt or bacteria can be flushed away. Now, if you've had a cartilage piercing done in your ear, you would know firsthand that one, it's impossible, not impossible, it's just really, really difficult to use salt water in the area. And if you're going to try and rinse away the crusties or discharge that gathers on the piece of jewelry while you're healing a piercing, you'll also know that you need quite a lot to do that successfully. Okay, so yes, saline is wonderful for cleaning lacerations. It is a really good cleaning agent for wounds. But in the situation of a puncture wound, it is not the best way of doing it, and using a mild antibacterial soap is the best way. Now, if you're a vegan or someone against animal cruelty, then that is perfectly understandable. But you're still going to then want to find a cruelty-free, mild soap to use, okay? It's just better. Also, when looking for a soap, you're going to want to check the ingredients and make sure that it doesn't have anything in that will irritate your skin. But again, best would be to talk to a medical professional. Right. So that being said, I see clouds in the horizon of people going, surgical spirit, rubbing alcohol, hydrogen peroxide. My answer to these is simply no. Right? All of these disinfectants are cyclotoxic. What that means is that it kills the healthy cells that are trying to form in the area, which exposes you and increases your risk of infection. It also delays the healing period. So none of these are a good idea in any way, shape, or form. And if you've used these in the past to heal your piercings, you're very, very lucky that you healed your piercing successfully with the stuff, but please don't do it. You're just asking for troubles in the long run. And then the last thing I want to deal with is this idea of using antiseptic ointments. So these are great if you have an infection or there's an onset of an infection, because these creams are designed to fight infections, right? However, if the area is being kept clean, then your risk of infection is exceptionally low, and you don't need to use these products, okay? And the main reason for this is because of how these products are designed. They're sticky, and this is what attracts the bacteria from inside the wound to them, right? So if there's no bacteria in the wound and you're using something that attracts bacteria to the wound, it kind of does the reverse. It attracts bacteria to the area and increases the likelihood of infection. So not a good idea. And secondly, nowadays most bacteria strains build up resistance to things really, really quickly. So if you're using an antiseptic as part of your regular aftercare procedure, if you do need to use that product because you have started to develop an infection, the chances of that product being effective against the infection is a lot less. So that's not the best idea, right? So just to wrap off the section nice and neatly, piercings are puncture wounds. Washing puncture wounds with soap is the best way to get them clean. So wash your piercings with mild antibacterial soap. And then because we've placed a foreign object into that wound, you want to keep the inflammation down as much as possible. And the best way to do that is either to apply ice to the area, or if it is safe to do so, to use a topical anti-inflammatory cream, however, only at the recommendation and advice of a medical professional. Right, so that's the majority of the piercings done. And the last thing that I'm going to talk about in this video is healing oral piercings, right? So piercings inside the mouth, because you can't wash them with soap. Like, that's just not a good idea, mostly because the taste is unpleasant. So how do we look after piercings inside the mouth? Well, these are really, really easy to look after because the tissue in the mouth naturally heals up quite rapidly. Think about the little cuts and scrapes you might get in your mouth, or when you bite your tongue. It's uncomfortable for a little while, but your body generally heals it up without much effort, okay? So what you want to be doing is you just want to be brushing your teeth as normal, eating as normal. The only thing that you want to be doing is incorporating an antimicrobial or an antibacterial alcohol-free mouthwash into your daily routine, right? I would recommend using this every 3 hours or so because it just keeps things nice and clean. So that is all for this video. Have pleasant misadventures, and remember, kindness is punk. Hey guys, post-production Maddie here. You're gonna have to forgive me, but in the excitement of shooting the first video, I forgot to say, if you like this content, hit like. Leave a compliment in the comments. If you don't like this content, hit dislike and leave some constructive criticism in the content so I can get better. Either way, smash subscribe and ring that notification bell so that you know when the next video comes up.